Thank you so much, everyone, for joining us today. Geeta, if I may start with you right away. At the start of this unprecedented times, really during this pandemic, as an entrepreneur, how did you all, sort of manage? What were some of the initiatives you took at the very onset of this pandemic?
It's great to be on this panel, and definitely COVID and related changes is a very important topic that we all should be discussing. Jola, just like every other startup, Niramai, which is our startup, also got affected by COVID. Being a health tech startup, we did see a lot of reduced number of walk-ins to our hospital installations. It's not just for our test, generally OPD, outpatient departments in hospitals saw less volume, and definitely one, because the hospitals wanted to control the mob inside the hospital and reduce the mix between COVID and non-COVID patients. And likewise, women and general people are trying to not to go to a hospital for non-COVID or non-critical, non-emergency kind of cases, right, and or diseases. So this was the situation, and so we did two things, and in hindsight, it was actually a good strategy. We were just sort of trying, late March, early April. If you just a one-liner about what we do, we use thermal imaging and AI to detect breast cancer early and provide a non-contact, non-invasive, privacy-aware breast cancer detection. So given that our technology and our expertise was in thermal imaging and software related to that, and given that all of us know that fever is one of the pretty common symptoms that we see in COVID, and thermal screening is a mandatory thing for all hospitals or corporates or whoever is opening up after a lockdown, we just sort of thought, why not retarget our technology to COVID situation. So we came up with this new product right now. We call it as fever test, COVID screening, automated COVID screening, where we just placed thermal camera in near the entrances of buildings or gates in the beginning, at the entrance itself for factories or hospitals. It could also be like metro stations, railway stations. And the software basically identifies whoever is going by as whether there is a person or not, essentially face detection. And then we actually measure the temperature of the person. And so basically it looks for COVID symptoms. We also look for respiratory abnormalities. We look for whether the person is wearing a mask or not. All this using computer vision and AI-based technique on thermal imaging and the real RGB imaging. So this is a new product. We just sort of, did the first prototype within a week and piloted, Kiran ma'am, Biocon, she was kind enough to sort of allow us to pilot in her office. So we did that. We fine-tuned the product, and now it's selling pretty well, and it's kind of compensating for the revenue loss that we had because of breast cancer screening. Another thing that we did was, obviously, we are here to save women from breast cancer as much as possible. So we didn't want to sort of divert our attention. So we've started new go-to-market channels for our breast cancer screening. So one is what we call as direct to doctor, because women are okay to go to a nearby physician, may not be to the hospital, but nearby physician. So we are providing the solution at the physician's place or a gynecologist's place, so that they can actually pull together their patients and then bring them like once a week or something like that. Second thing is home screening. This is first ever time anybody has done breast health or breast cancer screening at home. And so because our solution is radiation free and portable, we are able to do that very nicely. And we now have partnered also with Apollo clinics to actually provide this in all clinics and all places nearby these clinics in 4 cities today: Bangalore, Delhi, Mumbai, Hyderabad, and Chennai. So all of these places we provide home screening as well. So these are some of the things that we did, just immediately, I would say, innovating on the foot, and then trying to make our solution reach the consumers. And unfortunately, just yesterday we found during our home screening also a cancer patient who was confirmed, right? I mean, this is the need of the day as well.
That's rather incredible innovation in the face of this crisis. Sneha, if I may come to you and ask you, if you had to, pivot from any of your operations currently during this pandemic, and what were the primary reasons for the pivot?
Hi everyone, and thank you so much for having me here. I think I'm going to take a cue from what Geeta said and quickly introduce Zolo very quickly so that everyone has context. So Zolo is India's largest co-living platform. So we manage almost 50,000 beds across 10 cities in the country, and it's mostly a community for young, vibrant bachelors and largely students and professionals, who stay with us for long term. So, Dula, I think in terms of pivot for operations, I think in COVID, I'm not sure if there is any business which was not affected by COVID and which didn't have to rethink its strategy around operations specifically. Zolo is obviously no different. So I think I would like to call out two major pivots that we had to make. One was a forced one. So it was something which we did as a reaction to the external environment, which is basically our digital communities. And the second was actually from a place of opportunity rather than a place of, desperation. And that is basically the launch of our SaaS for rental housing management. So I'll talk about the first one first, which was basically our digital community. So, like I said, Zolo is a community of very young, like-minded, vibrant professionals, I would say. So we do a lot of deep, immersive community engagement activities. And pre-COVID, most of these activities were outdoor and also very physical in nature, right? So we had a lot of trekking and sports and all of these. And post COVID, or rather during COVID, we realized that we cannot do any of that. And the irony of the situation is that community engagement is more critical than ever because there were so few people who were left behind, and they were obviously feeling extremely lonely just being cooped up in their homes or in Zolo as well. So we actually moved our entire community engagement module to a digital piece, so whether it's engaging on Instagram and engaging on YouTube, also launching our own community engagement chat rooms within Zolo.
Incredible. Thank you so much for sharing that. Priya, coming to you next. What were your approach in dealing with the crisis and this unprecedented times at Zest Money? Just share.
Sure. I guess taking a cue from Sneha, just a one-liner on Zest Money. We are India's largest digital cardless EMI product. We work as a platform, and we work with retailers on the one hand and banks and NBFCs on the other hand. So going into COVID in March or third week of March, we were faced with two challenges. The first one was that given that we are a consumer credit product, there was a lot of uncertainty and a lot of noise around what the consumer credit behavior was going to be like worldwide, not only in India. And obviously parallels were being made about the 2007 and 2008 crisis, and how worldwide credit card delinquencies and any sort of unsecured credit delinquencies were going to be extremely high. So that was the first thing that we were faced with. The second thing that we were faced with was that most of our transactions are at the point of sale. And as you know, that in India, we had the most stringent lockdowns where even e-commerce activities were only limited to essentials. And so therefore people were, not necessarily looking for credit at the point of sale for essential services. So what we did was initially we focused on the first problem, which was the credit problem. To compound matters, the RBI also came out with their moratorium announcement on 24th of March, which was a good thing for the borrowers and for the country. But as usual with these things, there was a lot of noise in the market. And so the first thing that we did was started educating our customers about what a moratorium is and how that applies, or whether or not it applies to their loan transaction. and whether it's in their interest to avail a moratorium, because there might be associated fees and interest and things like that. So we did and given that we focus on a very mass market consumer base, our customer might be taking their first loan through Zest Money, or they may be a credit card holder, and they may actually know about what a moratorium means. So that in itself was a very big task. So we almost overnight change our entire marketing and comms team, and our entire strategy to team to basically focus on this moratorium education problem. We also implemented a moratorium in a completely product and tech-based mechanism. So we basically enabled customers to go onto the app, and they could opt in and opt out seamlessly. We were educating the customers about their applicable interest and things like that on the app.
Thank you so much for sharing that, Priya. And as we see, our entrepreneurs are really soaring high even at the face of this crisis. Lakshmi, coming to you. The research report at Your Story says that there's been a 54% decline in the first half of 2020 towards women-founded companies or startups, at least with one woman founder. And we have seen in the past that the funding is already skewed towards women entrepreneurs. So what are the primary reasons you think, in your opinion, is causing this, and what would be the solutions?
Thank you, Samantha, for this important question. And I would say that it is not just the funding where the women percentage is skewed. It is all over. I mean, you see in any ecosystem, startup ecosystem, how well we are represented. In education, how well are we represented? And I come from a background, I have been an engineer, and later I have worked with startups. And trust me, this percentage is so poor that I used to always feel that we should design programs where we could, bring in talented women forward. And that needs to be fixed from the ground level. So there are a variety of reasons, but one of the basic reason, I think, or the primary reason is what we teach our girls in family, in schools, in higher education, and later when we make them choose their professional careers. We tell them not to take risk. So the risk appetite is just so low for women. As a girl child, I don't think I was ever told to take this entrepreneurial path, take a 9-to-5 job and be done with it. Why take risk? I think that is one of the basic reasons. So other reasons which I am going to talk about are all interlinked, because you are not even letting women go forward and take this risk. Then how do you think that VC will find one fine day a good startup led by women founder? You should find also, right, he or she who wants to invest. They should find such startups in the first place. The second reason I would say is the all halla gulla around the startup. The way we are positioning startup in India and how we are defining the startup success has been just glorified so much. And I think nobody's to blame for. It is just the way India has been positioned in the global market because of the technology that it produces and the IT services revolution that India has witnessed. And I think that is why India is looked by everybody as creating the next tech giant or disruption in the technology space. And so everybody is looking for that disruption in technology space to happen. Now, where are we celebrating entrepreneurship is something which is missing in the whole equation. We are not celebrating the women who are running their own boutiques. We are not celebrating the women who are selling, doing their homegrown businesses. And they're doing extremely well. Do we have a platform to celebrate such women? I think we really lack such platforms. And unless we celebrate, women empowerment through self-employment, I think we won't be able to motivate more women to come forward and take up this.
Thank you so much, Lakshmi. That was really insightful and powerful, rather. I think the mindset change also starts with us, right, as women ourselves. And, telling our girls, telling young girls to sort of, have that mindset to go out there and do what they would like to see. All right, coming to you, Angel, last. From an vantage point at UK India Tech Hub, Could you share some trends and perspectives that you see on how women entrepreneurs have risen to the occasion at this point in time from your experience with interacting with women entrepreneurs?
Sure. Hi. So, firstly, it's wonderful to be a part of this panel and to share this virtual space with some strong women who are role models for women in the tech startup ecosystem. So, thank you for this opportunity. To answer your question, Dola, as we heard from our panelists, a lot of women entrepreneurs in India have been optimizing and rising to the occasion of this highly uncertain crisis. If we analyze how startups in India in mid-March responded to COVID, it had more to do with reducing risks in the form of layoffs and cutting down operational expenses. But as the pandemic situation worsened, we have been seeing more and more startups, especially women-led startups, pivoting to new ideas and business models. In other words, a new model for a new normal. This trend of adoption of a discovery-driven approach includes innovation in products, operation, and all business areas. Women have a lot of resilience within themselves, and it's really fascinating to hear from women entrepreneurs, especially like the ones in our panel today, how they are innovating and pivoting during the pandemic. In a few recent conversations that I had with a few women entrepreneurs, one of the most striking trend I observed is that a lot of startups and small businesses have gone digital now. Local businesses who used to cater to a specific city have now started websites or have started selling their products through social media platforms like Instagram and Facebook, thus expanding their geographical reach. More and more startups are thinking of implementing work from home post-pandemic for most of the week and utilizing co-working spaces for business needs, thereby being cost effective. Also, there are women-led startups who managed to leverage funds during the crisis. But personally, I believe the most unique perspectives are that of pivoting and innovation. To give a few examples, there are women-led startups making sanitary napkins that pivoted to manufacturing face masks, thus responding to the healthcare needs of the country during the pandemic. There are women-led startups focusing on building Internet of Things based products that pivoted to a contactless way of detecting temperature or making contactless payments. We even have our own alumni at the UK India Tech Hub, like GirlScript, who expanded their edtech platform to make it more interactive for their users. For us at the UK India Tech Hub, supporting women-led startup is at the heart of what we do. One of our three key aims is to deliver tailored interventions to cultivate digital skills, responding to the needs and opportunities for innovation in the local tech sector. A few months ago, back in June, July, we had our first virtual session called Go Global webinar series. It was an upskilling platform for tech startups, giving them access to the best of the resources and an opportunity to learn from fellow entrepreneurs from various countries like Indonesia, Israel, Kenya, Nigeria, and South Africa. We're also planning to soon launch another program to support startups that have been pivoting during the pandemic. And all our events are inclusive, and we ensure that at least 50% of our startup beneficiaries are women.
Now coming to Sneha, if you could just take us briefly through, the times are still uncertain. We don't know when it is going to get normalized. So what are your focus areas, and what is the plan for scaling up capabilities, operational capabilities?
Dora, I think I'm going to change the question itself a little bit. And I think one thing that I would want to talk about, something that, among the founders, at least at Zolo, and among the senior leadership at Zolo, it's not something that we didn't know, but it's just something that we've suddenly realized the importance of during this whole pandemic, and that is empathy. So I think all this while, and especially I think in young startups, it happens that people are so focused on just finding their footing and finding means to survival, if I may say so, uh, that we forget that at the end of the day, it's basically people who are working together, and people have issues, and it's not just about putting in 12 hours of work every day, or it's not just about sort of running a business, right? So I think one of the big areas of focus for us is to bring in empathy as a principle, as a rule, as a guiding force, as a factor in our organization. And we've done a couple of things to that effect during this period as well, right? So one of the things that we did for our customers was, in the last 5 years, any customer who has stayed with us, so anybody who stayed with us in the last 5 years, if they've lost their job, we are giving them free accommodation, right? So they can just come and stay with us for free, and we will not charge them anything at all other than the food cost. Similarly, for employees, we realized that most of the companies are deducting salaries, and that's something that we felt the pressure to do as well, because our revenues have also gone down by 75%. So it's something that was very critical for us to do at that point. But we didn't do that. In fact, what we did was we tried to actively manage our cash. We did do some deferrals, but everybody was paid back. So there was no cash cuts that happened on for any of the employees. And only the leadership team voluntarily decided to sort of not take salary for some time. So it's so one thing that has been eye-opening, or I would say something that has been very important for us, instrumental for us during this period, and I feel that it's very powerful, and it's the goodwill that we've created, which is sort of helping us stay afloat even today, when majority of our competitors have been more adversely affected compared to us, is the fact that we very quickly harnessed the power of empathy, and that is something that we want to hold on to. So that is the one key focus area for us as an organization, which is to build empathy at all levels.
I think that's so critical, right, Sneha? Like you pointed out, we are dealing with people end of the day and not just businesses. And
Yes.
fantastic. And empathy is at the core of should be at the core of every business. Coming to you, Geeta, if you could share some of the focus areas that you have and plans for scaling.
Sure, definitely. Like Sneha mentioned, we are also people focused. I always say it's the team, or Nira, my family. I never say Nira, my company. No, it is a family, right? And so all of us feel that way. The employees or sort of members of the family also feel the same way. So we had a similar situation, and the good part is everyone rose up to the occasion. We had like suddenly another product to support, and there was actually a lot of night outs and so on that was needed. So what we institutionalized was no pay cuts. That's, as Sneha mentioned, that we try to sort of manage. We got external grants to do some of our extra activities as well. And we also institutionalized special rewards and recognition program, because as we have people working from home, and they have families, they have kids and so on, right? So we institutionalized some HR processes as well, in terms of voluntary leave, in case they want to spend more time with the baby, because we have 70% ladies, female employees, and so we have to make sure that they are well supported during this time as well. So we announced newer leave policies where they do not obviously some of them are without pay because they have to take it voluntarily, and we have to be fair to everybody, male or female. So that was something they can choose to. And of course, this rewards and recognition program also brought in a lot of additional engagement at every department level, and also teamwork. One nominates the other, and sort of this kind of team building activities. And we have fun Fridays, every 4 weeks, So many of these sort of team engagement, Antakshari over, Zoom, these kinds of things we've actually instituted to have the engagement going within the team. Having said that, we have our own responsibilities towards our investment and to the goal the business has. So we also have, planned some scale-up activities. So what we did was heads down. It was a time in the first 3 months where we could not even go out to meet any hospital, any radiologist, any doctor, because one, they were very busy, either very busy or they were not coming to the hospital. One of the two things. So we all went heads down to focus on regulatory and basically the QMS, quality management system activities, which are more documentation and processes building place. Though that was one of the one of the pillars of any health tech company. It has to be, and it is for Nirma as well. We gave additional emphasis to that, given that most people are working from home, and sort of doing process documentation and adherence to it was more important. So that came up again and involved the whole team for a theme of saying, okay, let's get this particular international clearance by December and so on, right? So going towards the goal and then getting active, utilizing the fact that they are actually working from home. That is one. Of course, after 3 months or so now, doctors are able to meet and they are interested. And so we have been organizing several webinar sessions for women, generally for women health and so on, to reach out to the end users, because we are B2B to C, and we have to do some of the B2C activities as well. And also to, in general, help them, when they're at home, they're able to listen and create awareness. These are free webinars we have started as well. And most importantly, some of these programs like home screening and all of these, which are new go-to-market channels, require a huge amount of partnerships on the ground as well as digital. So we partnered with companies like 1MG, Potia, and digital health platforms, as well as on the ground Nightingale and Healthians. These are people who are already doing home screening and home collection, right? So we partnered with them to sort of get the scale both at the cloud level and the ground level, right? So that's something that we have proactively done.
Priya, if I may come to you with the same question.
For us, it's been very hectic. We've obviously continued to focus on expanding and on growing. In general, I think the biggest challenge for us now is more around the team side of things. Definitely, I think this continued work from home scenario, which we took to really well and really easily, I think that is something we will all have to work and see how to sustain it. So we've done a lot around engagement. We actually recently organized a completely online festival, which we call the Zestival. So, we've been doing a lot of things around engagement and keeping people happy. We've been focusing on team e-learning and giving them opportunities to learn and grow. But yeah, this is certainly something that I think all of us who are startups or a completely digital workforce, now we have to really deal with it and really think about what is going to be the model going forward. From a business perspective, as I said, lot of new opportunities, and we really think that digital is the future, or rather digital is now, and anyone who didn't believe in digital businesses really does need to look at digital and see how they can transform their business and transform their lives using digital technologies.
Lakshmi, coming to you, what would your advice be to women entrepreneurs who are looking to start up at this point in time during these really unprecedented times? What would your advice be?
Thank you, Samantha, again. See, I think this is really a time where women have been tested. The situation at home, managing everything, be for working professionals or even for women entrepreneurs. It has been a very stressful time. And at this time, if women entrepreneurs or aspiring entrepreneurs want to start something, I think they really need to upskill themselves. Right? I mean, everybody I am listening to talking about the importance of digital transformation or the digital platforms or the avenues that digital technology brings to them is inevitable. And we all have witnessed that in the last 10 months. If technology wouldn't have existed, I don't think we would have been talking like this, right? So many large-scale events are happening. So many things. World did not stop. In fact, we started looking at it from different lens. So likewise, I think if women entrepreneurs who are aspiring to start up now, it's a difficult time, certainly, but given the new opportunities have opened up, we need to assess and at this time, I think many ecosystem players also are coming up with programs to help startups whose ideas or whose existing solutions can be pivoted to meet the new circumstances. So there are such programs available even by the corporates-led accelerator programs or private accelerators, and in fact, government-led TBIs, or you talk about any of the government schemes-led programs. So they are providing avenues for such aspiring women entrepreneurs to come forward, think over, ideate, create a business model out of it, and launch their businesses.
Angel, how do you think the ecosystem can really enable women at this point in time? How can they help and support women entrepreneurs?
Sure. So, from a UK India Tech Hub perspective, it would mostly be regarding devising upskilling and training activities for women. We have a few activities in the pipeline, so catering specifically to women entrepreneurs. So, that would be one thing. And second would be to encourage more and more startups to devise advocacy and policy implementation for inclusive policies like healthcare, maternity leave, around those areas. Encourage and flexible working conditions. So that would be something. Second thing, and the third thing that I would think is see, a lot of businesses are pivoting. So at this juncture, they would need a lot of support from the ecosystem, be it to connect with a VC investor or a government agency. So there should be more opportunity in that sense. And fourthly, what we are doing at the Tech Hub is we have a very strong alumni network. So we even have a WhatsApp group, and if any of our alumni, they have an issue, they just ping us on the group saying that, hey, I need help with this. Do you have any reference? So we are there to support. So more and more companies and organizations should come up saying that, hey, we are here to support you. And that's what we are doing at the UK India Tech Hub. That's what the rest of the countries in our network are doing as well. So that is something I would like to see implemented.
Now, very briefly, your concluding remarks on how are you all dealing with the mental stress of, being locked down and dealing with so much uncertainty? Geeta, if you would like to go first.
Sure. I'm a strong proponent of sort of spiritual kind of practices. Thanks to COVID and thanks to work from home, I've been able to sort of reserve my 6 to 7:15 a.m. For my yoga practice. I follow Art of Living yoga practices. And so we have group sadhana on Zoom. So it's very good. So even though I sleep at 2 o'clock and I say, oh, I have to join the 6 a.m. thing. So that has been a tremendous, stress buster or general control on the body, because you just sit in front of the laptop throughout. So you need some physical activity. So that's one big thing that I have done. I recently also started some diet programs so that, you really hog a lot when you're at home and you are thinking. So those two things I've done. I guess, and listen to music and so on. Continue to do that.
Priya?
Yeah, so similar. So I do a bit of yoga, I exercise, I walk and listen to music. Also, I think one of the other things is that our co-founders and team in this time have been really helpful. So we share, we make it a point to talk on various topics, as co-founders at least once a week. When the lockdowns opened, we did try to go to office a few days, and that did become almost like a social activity with some of the team members. So that's also something that we have been doing, that it's a completely voluntary way for people to come into office and interact and get some social interactions, but also spending a lot of time with family and keeping in touch with friends, and a bit of Netflix. I think that is something that is inevitable right now. So those have been things that have helped.
Thank you. Lakshmi? And this is also kind of, an advice that goes out to all the women watching you, or in fact, all the people watching us today. So Lakshmi, how are you dealing with the whole situation?
I'm so happy to hear that so many of the panelists practice yoga, and I also practice it every day. Every day, 6 o'clock, I get up. Whatever time I sleep, I really look forward to attending my yoga class, and that really energizes me for the rest of the day. I think if I was not into yoga, I don't know how I would have taken this COVID. Because there is so much running around at the home and managing your work, managing your children, managing house, and no mates. So it was really very difficult. It was a new situation at home, and but then yes, your pillars are your family support. So I think I had such a tremendous support from my family members. Connecting to my mother every day over Zoom was, I mean, we do talk otherwise, obviously, but during this time where, you have missed your summer vacation going out with family, you could not connect with them over the Shera. So I think Zoom or other platforms have saved us going crazy. And adding, I think last bit would be a bucket list of all the movies that I always wanted to see. I got some time to see those during this time. Otherwise, we were just running poster pillars, right? So I think that's a bit of advice is to do physical exercise is a must.
Angel?
Yeah, so for me, I'm a lazy person when it comes to doing yoga, but I enjoy going for walks and Netflix, as Priya mentioned. And thankfully, I'm part of a very nice and friendly team. So we do checks every once in a while. Are you okay? Are you doing fine? Are you eating well? So that is something I think startups should do a regular check on their team members. And as part of our office, we have every Friday we have a chai session where we have fun quizzes, and then everyone will get onto a call with a cup of tea, and then we'll see just general knowledge quizzes or fun questions or something like that, just to feel connected to your team members. And recently, we also had a session on mindfulness, how to cope up with the situation that is happening. So all those things are helping me and my team, I believe, very much.
Fantastic. Sneha?
I think so. I think I have to admit that I had a very hard time during the first phase of the lockdown, which is like April and May. I think I was in a very bad place, and I feel that I have been able to become much better than what I was at that point in time, or in fact before. In fact, I feel I've become better than what I was mentally pre-COVID as well. I think I would want to give credit to one of the biggest things that has happened, which is basically a group of women entrepreneurs forming, WhatsApp. So we have extremely active WhatsApp groups now of only women entrepreneurs, and then there are subcategories within them, right? So women entrepreneurs from IIM only, and then women entrepreneurs who are in Bangalore, etc. So I think these groups have helped me the most because it's such a like-minded fraternity. You can go and really just talk about everything. And every day, at least there was like 1 hour of bitching about non-contributing husbands at home, because that was like a huge stress adding factor for everybody. And it just felt, I don't know, comforting to know that you're not the only one and that there are other people who are going through that same situation. And even other things like the fact that you just within the home and you have no access to anything. So I think for me the advice or the message that I would want to give out is that the lesson I have learned for myself is the fact that if you are in a bad place or if you feel that you're not doing well, it's very important to just go out and ask for help. You don't have to be ashamed about it. You don't have to be shy about it. And it's okay if, the person in front is not your best friend or it's just somebody you've never met. Uh, if it's a like-minded group or if it's a like-minded sort of fraternity, you must be a part of it. Like, at least there has to be some group which is a very, very like-minded group, not different group, where you can really just, have a conversation without feeling the pressure of what will that person think about you, what will that person tell you, what will that person do. Even if that person can do nothing, it's fine. Just venting out will help, or just asking for help will help. So I think that is the biggest thing that for me was very instrumental.
Thank you so much. Thank you for being so candid. I think all of you for being so candid and sharing freely. I'm sure this message would help millions of other women watching us. Thank you for your time on the panel today. Have a good evening. Thank you so much.